Hello. The title of this presentation is Assessment and Management of Lifestyle-Related Risk Factors in Physical Therapist Practice. The authors of this paper are Andrew Ward, Caleb Liu, Joshua Jacob, and Michael Ross. The assessment and management of lifestyle-related risk factors in the elderly is crucial in healthcare settings around the world for the prevention and appropriate management of the disease. These risk factors include, but are not limited to, smoking, diet, alcohol intake, and physical activity. The purpose of this study was to assess lifestyle-related risk factor assessment and intervention practices of physical therapists from the United States. 500 physical therapists, all of whom were randomly selected from members of private practice sections of the American Physical Therapy Association, were invited to participate in this survey-based study. 88 physical therapists agreed to participate, for the 18% response rate that was acquired. In this study, there were 45 women and 43 men. The mean age was 36 years old, and the mean time of clinical practice was 12 years.
Participants completed the same previously validated survey used by Abargu et al. And O'Donoghue et al. That assessed lifestyle-related risk factor assessment and intervention practices of physical therapists from Nigeria and Ireland, respectively. More specifically, the survey consisted of 32 questions presented within 6 key sections. These included demographic information, assessment of risk factors, management of risk factors, lifestyle counseling, barriers to assessing and managing lifestyle risk factors, and also training and education. The survey was scored and analyzed in the same manner as Abargu et al. And O'Donoghue et al. With regards to results, 79% of the respondents noted that it is important to address lifestyle-related risk factors with their patients. As noted in Table 1, physical activity level and smoking status were the only risk factors that the majority of the respondents reported that they always included at initial assessment of new patients. And then over half of the respondents reported that they usually or always assessed family history of cardiovascular disease or diabetes. And in relation to other risk factors, less than half of the respondents regularly assessed alcohol consumption, anthropometrics, and dietary status. And last but not least, only 17% of participants regularly assess blood pressure.
In terms of managing the risk factors, all respondents regularly advised patients to participate in regular physical activity or exercise. However, less than half of the respondents regularly advised patients to stop smoking, improve their diet, or decrease alcohol use. As noted in Table 2, the most significant barriers to assessing and managing lifestyle-related risk factors included time, perceived lack of patient interest, lack of education materials, and lack of expertise. In conclusion, with the exception of physical activity, physical therapists inconsistently assess lifestyle-related risk factors or appropriately intervene to address them. These results may have important implications for health policy decisions and the education and training of physical therapists on the importance of assessing and managing lifestyle-related risk factors in the elderly. We would like to thank the Network on Aging of Western New York for a chance to present our work and the participants who took the time to complete our survey. Thank you so much.